the preventive care that we are talking about. There are a lot of problems about the inability of NHIA to pay its debt. Some of the factors are known, some are not too known. There is a need to take a serious look at the revenue mobilization and payment of providers, which is beyond the scope of today's discussion. Suffice to say that what the revenue that NHIA is getting is not enough, even if preventive care doesn't come in. So there is a need to the NHIA, which has helped a lot, to be honest. It has really helped compared to the time of the cash and carry. But coming to the question of adding on the preventive aspect, as my other colleagues have already said, at the end of the day, there is going to be a net gain because prevention is always better than cure. And if they organize it very well and people are able to buy into it, and then there is screening and so on, and they reduce they prevent the diseases the non-communicable diseases that usually NHIA spends a lot on, then it's going to be beneficial at the end of the day, in the long term, for the NHIA. Let's look at what we expect when we are talking about a typical screening system. For instance, you need to know, some of them are not very expensive at all. I mean, they are not even expensive. Clinical history, for example, they will want to know your immunization history, whether there have been their BP status and tests, family history of diseases, past medical history, information about their workplace, their living conditions at home and leisure, and habits like drug use, alcohol use, smoke, exercise, sexual practices, use of seatbelts, helmets, all these things. They are not any expensive things. It's just a change of mindset. So if they are able to empower the health provider and shift the paradigm by from always looking for the strictly creative aspect, that when somebody works into the health facility, you know, the typical thing that the doctors will do, and they have to go to lab and so on, they should include other services. I'm seeing the NHIA approach as getting the low-hanging fruit. People walk into health facilities with underlying conditions that, because those are not the complaints, they walk out and nothing is done about it.
Yeah.
So, yes, when you look at, they go to hospitals and then they will take your vital signs like blood pressure, your BP, and that's all. What prevents the health facilities to take the height and then the weight. And then from the height and weight, they are able to determine the body mass. And when they determine the body mass, they'll be able to know whether the person is having a healthy weight or unhealthy weight, and the risk of getting diabetes. This can be added to the traditional vital signs that is always taken by nurses. And it doesn't cost anything. Health insurance can even support with some basic equipment like weighing scales and so on that will let, health providers do these things. So some of the basic tests like BP and so on don't really cost so much. It's just a paradigm shift. We need to also encourage the health providers to shift their paradigm from the curative mindedness to preventive mindedness, meaning that we need to now make use of dietitians and nutritionists seriously in health facilities. Some of the hospitals, they already have them, but they are not being utilized. Meanwhile, they can give advice on diet and so on to hypertensive patients, diabetic patients, and so on. So we need to begin to take them on. What also goes into screening, like look at the physical examination of the head, the neck, eyes, and so on. Then they want to look at the blood cholesterol levels. Maybe those areas may need some lab tests and so on. The woman pap smear, to prevent cervical cancer, breast examination, sexually transmitted diseases from the history. They will know those who are at higher risk of getting sexually transmitted diseases and offer counseling, cancer screening, especially those 40 years and above, including either the breast, cervix, prostate for males, and so on. These are, and then counseling, limiting of dietary fat, general nutrition advice, choosing tobacco cessation, drinking and driving. These are some of the things that will go into education. And I agree that I think Doctor wanted to say the other time, I mean, Dr. Sapo said when he spoke that it should not just be limited to the clinic. You see, Ghana is very good with our public health system. We are one of the best practice countries in Africa as far as our public health system is. It should be incorporated. We have a lot of kids sometimes, community health nurses who go around and so on. I'm sure when they figure out the way to do it, some of the things that are easy to be done without people even going to the hospitals, they can be done. And then those that can be done in hospital, like checking blood cholesterol levels and so on, can be done in the hospitals. I don't know the way they want to design it. But we need a complete paradigm shift. Doctors might change their attitude. Nurses might change their attitude. We need to bring in nutritionists, dietitians, and so on into healthcare. We need to look at when people walk into hospitals, even with complaint of malaria, and they are overweight. You should be able to inculcate the assessment of the person's weight and the dietary advice given to the person, even though the person didn't report with that. And I'm sure that's what the NHIA is doing. So the cost of preventive care is far less.
Yeah.
And if we tune our minds well, it should be possible to do it without money. So after the cost, and the NHIA needs to really take a second look at the your main source of revenue is 75% is from VAT, and we don't have jobs increasing and the population is increasing, and the premium is less than 50 cedis, and yet the cost of one health visit is over 200. It is unsustainable, and it's not necessarily because we are bringing on the preventive aspect in addition. We need to look at that separately, but we need a complete paradigm shift.
Yeah.
We need to tune our minds and to know that we are in a trajectory of moving away from the communicable diseases to non-communicable diseases, as the statistics show, and we better set up now.
Thank you so much.